One of the common conditions that I see in the office is patellar tendinosis, though often people come in saying that they have patellar tendonitis. So I want to kind of explain what the difference is. Obviously, if an athlete right away gets injured, and for instance, this is a model of the kneecap. When you have patellar tendonitis, it means that this tendon right here, the patellar tendon, is all inflamed. So that's going to be like when a runner has knee pain and it occurred right after a run. Like right after a run and it's the first time that it happened, most likely they have patellar tendonitis. So in patellar tendonitis, when you poke on the tendon, it's very, very sore, and when you contract the tendon, it's very, very sore. If the athlete gets cortisone shots in the patellar tendon, or they take anti-inflammatories for a very long time, the tendonitis becomes tendinosis, it becomes degenerated. So obviously I would say don't get a cortisone shot into a tendon, and don't take anti-inflammatories for itis because it blocks the pain. And so if you continue to work out, like you continue to run, when you have patellar tendonitis, all that's going to happen is the patellar tendon long-term is going to degenerate. A much better treatment option, I feel, is if you have patellar tendonitis, like a true patellar tendonitis, is whatever athletics was causing the patellar tendonitis, obviously you got to stop them. And tendons and ligaments love motion, so you have to exercise the tendon without putting a lot of stress on it. So we typically recommend things like cycling and swimming, if those things don't cause a lot of pain. And then ideally get on a good nutritional program, put heat on it instead of ice, and then also take enzymes, digestive enzymes. A common one that's over the counter is called wobenzyme. And at our facility, we have a combination called Enzyme Max, but those things help tendons heal very quickly. If the tendonitis doesn't get better every week, like technically it should keep getting better every week, if it stops getting better, what I would recommend is get prolotherapy. It may seem like, well, geez, why would you get prolotherapy? Well, often when a runner has patellar tendonitis, the actual cause of it is joint instability. Like you can understand if somebody had, and the most common ligament that we see injured when you have patellar tendonitis is actually anterior cruciate ligament injury. And what that does is if the kneecap, you can understand if the knee is moving too much, because you got anterior cruciate ligament laxity, that's going to put a strain on the patellar tendon. So if an athlete has patellar tendonitis or patellar tendinosis that isn't getting better, despite changing their athletics, like they're not doing as much, they're resting it, or they're cycling and swimming and they're not running, they're doing everything correct, but it's not getting better, then it's either the patellar tendon just can't heal on its own, like you need prolotherapy, or you have an underlying ligament problem. In other words, you have knee joint instability, and now when you go back to your athletics, the knee joint's not stable, so it's moving too much, and that's going to irritate the tendon because the tendon only has power when it contracts against a stable knee. So obviously, if you have an anterior cruciate ligament laxity or some other ligament injury of the knee, those also have to be treated with prolotherapy. So it's very common in the office here at Caring Medical for us to treat patellar tendinosis and tendonitis with prolotherapy because the person has failed conservative care. Like they tried rest, they tried cycling, they tried swimming, and they still have the problem. So what I often find is that they have an underlying joint instability. Once the joint instability is treated and the tendonitis or tendinosis is treated, then the condition resolves.